So how will a COVID-19 humanitarian staging area at OR Tambo International Airport operate? The area set up by the United Nations is part of efforts to curb the spread of COVID-19 and ensure accessibility of humanitarian assistance. Masego Rachacha is following that story and she joins us from there. How is it going to work, or how's it looking, Masego?
Good morning, Jane. Well, as you can see, behind me are some of the humanitarian workers that have been dropped off with the bus. The bus actually just left right now. As you can see, their luggage is on the floor right now, and what's been explained to me is that there'll be sniffer dogs coming here to check that everything is okay there. So they are the workers who are going to be going around the African region to help out with COVID-19, you know, the fight against COVID-19. But I do have with me some of the guests that will explain more information to us in terms of how exactly this will work. We're expecting that the minister will arrive at around 8:30, if I'm not mistaken, if he's not here yet. But I do have with me, first of all, a lady from the World Food Programme. Her name is Lola. Thank you so much for speaking to us, ma'am. You're live on eNCA. Can you just explain to us exactly how this will work?
Thank you very much. My name is Lola Castro. I'm the Regional Director for World Food Programme for Southern Africa, the SADC region. And we want first to appreciate the South African government to allow this to happen. What is happening today is 69 people are going to go to 20 African destinations to do their humanitarian job. And they are going to be able to do that thanks to these flights with South African Airways, which were allowed by the South African government to fly. There are only 3 hubs in the whole Africa flying humanitarian workers. One is Johannesburg, the other one is Addis Ababa, and the other one is Accra. It's extremely important because we have talked to these people this morning. We have people from Doctors Without Borders who are going to remote locations to really do their medical work after having done it in South Africa. We have talked to people from peacekeeping from Central African Republic, from Somalia, Mogadishu. They are going back to their duty stations where they need to do this very relevant peacekeeping work. We have also talked even with one ranger from the DRC, Democratic Republic of Congo. He's going back to work in the Virunga parks where there is a war to defend the nature there. So basically what we are doing here today is the passengers have arrived from multiple locations, including South Africa, but also from Malawi and from Mozambique yesterday. They arrived with a humanitarian flight. Today they will be going to Addis Ababa, and from there they will connect to the other locations in Africa through these humanitarian hubs by World Food Programme, WHO and the United Nations. It's a common services supported by the African governments. So that's what is happening today. Now the bags will be checked, they will be screened, they have all been clearly isolated, so that it's clear that they cannot transmit anywhere. Whoever came from Malawi or Maputo yesterday was in a hotel under quarantine and just moved in a protected environment to the airport. And now they will be taking the temperature before flying, and then they will fly to their locations. So basically a humanitarian work, very important, and these flights are allowing it, and thank you South Africa for that. Thank you.
Thank you very much, Lola. Now, I do have with me as well Dr. Rajesh from the World Health Organization. Sir, can you just tell us, how important this is? For instance, I'll tell you in South Africa, there are reports that our health system is basically collapsing because we are experiencing winter here, and now there's more people needing the hospital. We're running out, for instance, of ventilators and other equipment. How important is something like this to happen around the African region?
Thank you so much. I think it's very, very critical because what we've seen globally with COVID-19 pandemic is that the supply chains have been constrained. The humanitarian movement, the worker of the humanitarian movement of the humanitarian workers has also been constrained. So when the heads of the WHO and World Food Programme wrote to President Ramaphosa, he was very kind to open up the spaces. What we've seen with COVID-19 pandemic is that with lockdowns and restrictions of international travel, it has become immensely difficult with the airlines not moving, the supplies not moving. So COVID-19 response has taken a huge hit. But now with support from DIRCO and the Department of Health and other government departments, this hub will be moving huge number of humanitarian workers, not only for South Africa, but also to the neighboring countries, as well as the much needed essential medicine and equipment, which will be really instrumental in the COVID-19 response in South Africa and in SADC.
Now, Doctor, can you just explain to me some of these humanitarian workers? I know there's healthcare workers, but I know that the World Food Programme is also involved. So can you just explain to us what some of these people, the humanitarian workers, do? What are their fields?
So as my colleague from WFP, Lola, mentioned, I mean, we have humanitarian workers who I just spoke this morning with the minister. There are colleagues from MSF, Doctors Without Borders, who will be going to work in a field hospital in Khayelitsha. We know Western Cape has the highest number of cases in South Africa. We've got rangers who will be working on conservation efforts. We have peacekeepers who are going to other countries to maintain peace. You know, so it's not only the humanitarian work, but also essential services beyond the COVID-19 response that will be taken care of through this hub, which is now in Johannesburg.
Thank you very much for joining us. Well, Jane, we are still going to be taken into the airport, hopefully to be able to see exactly what happens once the humanitarian workers have made their way in, and then we'll probably be able to wave at them as soon as they fly to Addis Ababa.
Okay, it'll be good to see you, Ms. Thank you.